2. Good morning, everybody. Good evening, wherever you are. This is Dr. Morgan Crowley. Did I say it right, Morgan?
Yes, you did.
Because we have never met. And in this impromptu interview, I'm going to speak with Morgan about her chiropractic career incorporating Atlas Orthogonal and her affiliation with Dr. Roy Sweat and the team at Sweat headquarters, Matthew and Tekla. Good morning, Morgan.
Good morning. Thank you so much for having me on your show.
In what is your evening in Ann Arbor, Michigan?
Yes, this is our evening.
Fantastic. Tell me a little bit about yourself.
I am from New York originally, Buffalo, and I did my schooling at the University of Buffalo University of New York in Buffalo. And then I went down to Life University. The reason I went to Life was while I was at the University of Buffalo, I was doing post-concussion syndrome research, and I was an intern helping there. And one of the guys said he was going to go to be a chiropractor. And I said, what is that? I've never heard of that. Well, I had maybe heard of it, but I had never been. And he said, you should give it a try. There's interns on campus and it's free. So I was poor and I said, okay, that sounds great. If it's free, it's for me. And so I went and I tried chiropractic for the first time ever on campus. And my arm would go numb when I ran. And that was because of a car accident when I was 5 years old. I hit the windshield. And so I didn't know. I didn't put that together back then. Who would know? My parents never took me to a chiropractor. I had torticollis when I was 12, and my head was stuck like this for a week, and I had all these different issues. And so it was by chance that I met this gentleman, and we got talking, and he told me to check out chiropractic. And then that's my story of how I heard about Life University and why I chose to make the different path from medicine to chiropractic care.
Wow, that's a wow story. And as they say, nothing by chance, right?
Absolutely. I think chiropractic chose me, as many chiropractors say.
Yes. And so at what point did you discover the upper cervical work? And Life University is a great one. They have programs in upper cervical. Did you meet the Sweat contingent at Life?
Yes. So when I was at Life University, I had an intern who was doing manual adjusting on me. And I remember one day, and I'm sure most chiropractors have had a story with student interns where I walked out with sciatica that I did not walk in with. And I called my friend who I had met through school, and I said, I don't know what to do. I have sciatica, and I know I do, and I didn't walk in this way. And she said, meet me back at student clinic. I can help you. And her dad was an Atlas orthogonal doctor, and she was going to be an Atlas orthogonal doctor, and she is today. And she adjusted my Atlas. And there was probably some time in between. It wasn't one-to-one. There's the bureaucracy of student clinic and changing patients. But she adjusted my Atlas toggle, and it was amazing. I had never had that done before. And so I said, that was incredible. It helped me and so much. And I said, what are you going to do? And she described Atlas orthogonal. And then she got me started on the path with the sweats. I just knocked on Dr. Roy's door one morning and said, I want to do this. How do I do this? And he gave me the basic book and said, start reading while I was at the office. So that's how I got started with Atlas orthogonal. Obviously, chiropractic is very safe, and in general, and the student, you know, must have, I don't know what happened that day, but it went away and it's never returned. But it certainly was, again, nothing by chance. It was all meant to be. And so that's how I found upper cervical, and then the sweats, and my health has continued to improve under Atlas orthogonal care.
Well, that's wonderful. Do we know who that doctor is? Do you say she practices now?
Yeah, so that's Dr. Christy Osborne, and she practices in Chattanooga, Tennessee.
Oh, okay. All right. Excellent. And what are your aspirations for the future? How do you see things developing in not only your career, but for chiropractic in general in the US?
So I would like to see, you know, parlaying on my story, I would like to see more chiropractors become involved with upper cervical, and more people understand why this is, you know, particularly Atlas orthogonal, why we do what we do, why it is the strongest technique with research, um, and to spread that message to people. You know, I think that that's so important. So many people of my patients that I see in Michigan, and I'm sure Atlas orthogonal doctors throughout the world, obviously yourself in Sydney, um, know patients that have tried everything. They've been to traditional chiropractors, they've been to physical therapy, they've been to pain management clinics, they've been everywhere. And they get the most relief with Atlas orthogonal. So I would like to spend my next 5 to 10 years researching, writing as much research as possible, you know, writing up case studies, and really devoting time to the betterment of our profession. I think that that will serve us as a group.
Okay. Yeah, I mean, I think that I've seen manual adjusters get miracles. I've seen, you know, Gonstead or even Diversified free up humanity of suffering. And I think we need to respect that there are specialties and that we should be inter-referring, a bit like Dr. Jeffrey Hanna, my previous guest, said, that he refers out if the patient needs something else, especially chiropractic. But in your case, when you say you'd like to get into research, are you saying you'd like to remain a clinician and write up case studies, or you would like to go into like hardcore research?
I think a bit of both. I think it's
Really?
always smart to do, start with case studies first and what I'm doing as a clinician, and then you know, I think following how medicine does things has proven, you know, their strategy where they have people that work a few days a week, and then they have dedicated days to research. I think that that would behoove the profession.
So do you have like a barrier to you entering like writing case studies? Do you need assistance? What do you think? Are you ready to go, or do you need help getting published?
I think getting help started. Yeah, getting help. I need help getting started. I haven't done a case study since grad school, so I don't remember all of the different, you know, nuances to writing those up
Yeah.
professionally so that they are accepted in other journals, and
Okay. Well,
think
what I
that's
might do
important.
is I've got some people that I'm thinking of that can give you a leg up on that. And maybe I'll do another presentation where we can guide clinicians into writing case studies. So, and you and I will keep in touch. I've got a journal that may suit you to the ground. The Asia Pacific Chiropractic Journal is accepting, and also we might get someone from the Subluxation Research Journal on here and try and help people get their case studies up there. What would be the if you had some case studies in mind, what would you publish tomorrow? What kind of people have you had?
I've had 2 cases of brachial pruritus that have completely recovered. That was one of my first patients had brachial pruritus, and then I had another woman with that, And those two right off the bat, people don't, that's itching on the arm for your viewers that may not be familiar.
No, I don't. Brachial.
Pruritus.
Oh, pruritus. Yes, yes.
Sorry, I had double jaw surgery in November, so I apologize if my speech is off.
No, it's not that. It's just that you don't really hear brachial pruritus very often. It's probably exists and no one actually goes to a chiropractor for it.
Right. Yeah, I think it was by chance really that these ladies found me. And like I said, one of them was one of my first cases when I graduated, and they itch themselves so much that their arms bleed at night.
Oh.
And the dermatologists are telling them to put capsaicin, which is cayenne pepper cream, on their open wounds on their body. I mean, I can't imagine putting cayenne pepper powder on my powder cream on my wound on my arm. And that was their solution to these ladies. Isn't that terrible? And they're scratching all night long. They're not sleeping. Both were mothers of, one mother had 3 children. The other one had also 3 children. So, they're trying to keep up with their kids, and at the same time, they're scratching themselves silly. So,
what was the kind of time frame from adjustment that it cleared up?
I think realistically, it took about 2 months.
Yeah.
4 to 8 weeks until it was clear. I remember the one woman, I still take care of her and her entire family to this day, but at first she was coming in with sweatpants and sweatshirts on, like t-shirts, and which is fine. But one day, about 6 weeks into care, 4 to 6 weeks, she comes in and she looks fantastic. She is dressed to the nines. I said, wow, what do you have going on today? You look so, dressed up. And she goes, what do you mean? I dress like this every day. And I said, well, not in the last, not since I've known you. And she goes, oh my gosh, I have not had the energy to get dressed because I am someone that needs 8 hours of sleep a night, and I am not getting that. And she goes, to be honest, if you couldn't help me, I was going to pray that the cancer came back. She had cancer before and took me. And she had 3 young kids at the time. And no pressure. I'm so glad that she didn't tell me that really until after she was better, because that's so heavy. That's such a terrible feeling that she felt, that, she would rather not be here than to deal with this, itching that she felt had
How
no
long
end
did she
in
have
sight.
it for?
6 months.
Right. And you've had 2 cases of similar.
2 cases of brachial pruritus lasting.
I think we've got to get those 2 case studies maybe written up in one paper and go from there.
Absolutely. And one of my other first cases, was a man. He was about 49 years old. He came in at 400. I think he was 450 pounds.
Wow.
At the time. And he should be about 6'6", and I say should be because he is a few inches shorter than that, because he has steel rods from his bottom of the neck down to his mid back. His entire thoracic spine is encased in steel rods from he had a bad kyphosis in his teenage years. And so again, for your viewers, he was what we would consider a hunchback syndrome. And so when he was 17, he had steel rods put in his, a big chunk of his spine. And he used to smoke, and and then he became very overweight, obese. And his doctor said, if you don't change your lifestyle, then you will die soon. And he was eating Tylenol, Motrin, and of course he was scared to go to a regular chiropractor because he had these steel rods in his back. And so he came to me, and through the AO adjustment, within 4 weeks, he was off all medication, all anti-inflammatory medication, like the Aleve, Tylenols, And within 6 months, the lack of pain, the pain being gone, gave him the ability to change his diet, exercise. He put in a tremendous amount of work. And within 6 months, he was off his high cholesterol, diabetes medication, high blood pressure medication.
Wow.
And he ran a 5K and he lost almost 200 pounds. He's 280 pounds now. So we still stay in touch. These are cases from when I practiced in Charleston, South Carolina. And so him and I still stay in touch. And he's still doing fantastic to this day. And he still receives upper cervical care.
Wow, lots of good stuff. Now, give us a opinion of your experience under learning with Dr. Roy Sweat.
I think
and
of
Matthew.
Dr. Roy and Matthew. Yeah, I think of them both when I'm at the office. They are absolutely brilliant when it comes to this work. They are, I think they always say the devil is in the details. And the new things that Dr. Matthew is coming out with the looking at the asymmetries in the condyles, the asymmetries in the atlas bone. And
he's the dry bone man.
He is the dry bone man. And I was just speaking with our other colleague, Dr. Rosa, 2 weeks ago about a patient.
Dr. Rosa, we need about 6-hour program for him.
I know. He is so great. I can't say enough great things about him.
Oh dear.
But really, he's seeing that as well, the asymmetries on the MRI. And this is something at our advanced seminars. I was at the one in Atlanta in May. Dr. Matthew is bringing up these asymmetries, and he's been saying this for a while with the dry bones. And Dr. Roy, of course, he can, I know that that's something that they all pay attention to, are these details. And I think, BJ Palmer really paid attention to the details as well. And I think that's something we can all learn from these guys is the details.
Yes, I think BJ facilitated that by collecting like 2,000 and whatever spines of all shapes and denominations.
Yes, he did. And so I see that similarity in Matthew, and Dr. Matthew Sweat, and I see that he's doing that. So, and Dr. Roy, you can be sitting at a seminar and think that he's not paying attention to you, and he'll look at you. Morgan, see you over there. So I know that.
Yeah, but Morgan, he doesn't look at me. Hanny looks at pretty women.
Thank you.
Yeah, that's Dr. Roy. He's still normal, even though we think he's like Captain Superhero. I call him the King of Atlas because Roy means king, and he lives in Atlanta, which is what Atlas held on his back. So Dr. Roy is the king. So yes, and did you have them in undergrad or postgrad?
Postgrad.
Okay. Yeah.
I did take his course actually because of Christy Osborne. I
was lucky enough to have met him, while I was not even a year into my studies.
Oh, that's so fortunate. It took me about a year to meet him. And then like I said, I knew that I wanted to work with do the Atlas orthogonal. So that's when I went down to his clinic. And the clinic, for those of you who don't know, is not that far from Life University.
No.
And so I think that's really for people that want to specialize in Atlas orthogonal. Like you said, there's 80% regular chiropractors, generalists, we'll call them, they get 80% of patients well. It's the 20% that I tell my patients that really need.
I think you're right. Yeah, it's an 80-20 breakdown. I agree.
So that's, I don't have a bad word to say about them. I think they
Mm,
do a great job. And 20, of course, we can see everyone, but 20% really need to be in our
mm,
office from, injuries, accidents, things that
mm.
have
And I
really
think it's kind of
disability.
overly dramatic and impactful, because those 20%, maybe 10% of them are horrendous cases that have been
Mhm.
left on the shelf, right?
Yes, yeah, and to them, it makes a world of difference, the work that we
Yeah.
do. You're changing lives, and just the 3 cases
Mm,
that I've shared today, most medical professionals would argue that
mm.
if they saw one of those cases with that kind of success in their career, that would make it all worth it, and,
The
we're seeing
tragedy
those
also is
20%.
that I think, 5% or whatever of those are on horrendous pharmaceuticals.
Yes.
They stick them on this mind-bending stuff, and yet the medical people. I had an argument with a medical person today about, um, you know, that Atlas orthogonal never helped one person on Earth. I said, really? Okay, I don't get it. And all these poor souls are drugged up. And America. What's the terrible statistic is that US is consumes a huge amount of pharmaceuticals, and it's only a small percentage of the world.
Oh, we consume most of the pharmaceuticals,
And
and we're one of the
antidepressants.
sickest countries. I think we
Yeah,
rank 35th overall in health,
yeah.
and we consume like 98% of the world's pharmaceuticals. So clearly what we're
Mm,
doing isn't working, but we're trying to spread that to other countries. So that's not a great system to follow, and to say
mm.
we have we have the best healthcare simply isn't true, unless you're specifically talking about Atlas orthogonal and Roy being the progenitor of that. Then yes, we do have the best, because Roy is in Atlanta, so we're lucky to have him.
And what do you find is unique about Dr. Roy's delivery when you sit down and listen to his lectures? What do you, like you said, he notices what's going on. He's extremely aware. Is there anything else that impresses you about the program?
The program in and of itself is very thorough. One thing I took for granted when I was a student is I thought that it was very repetitious. And it actually took me into my career to understand that the repetition is there for a reason.
Yes.
It's because you need to know this, you must know this.
And he says
And
that we learn by degrees, right?
we learn by degrees. And so I think when people get started, if there's any future Atlas doctors out there, be patient with yourself and with the program, because it's designed in such a way to make you an expert in something. And um, you need that repetition to learn how to deliver the best care.
Mm.
um, because you're going to see patients that will get well, and it's a matter of degrees, millimeters, centimeters. It's, we're really not talking about centimeters, we're talking about millimeters and
Yes.
tenths and hundredths, and that's the difference in the care. And he tries to um, you know impress that upon people. You need to take time, and you need to study this is not something that you can learn overnight at a weekend seminar.
Mm.
This is something that takes years to it's very easy to press the button, but it takes years to develop the skill.
Yes, yes, when not to press the button. And the buzzword in surgery is now minimally invasive. So we've always been of that mindset. Do you have anything else to add, Morgan, to our discussion that you'd like to say?
Well, I would just like to say, to your point about the pharmaceuticals, is that, people should be careful of what they think is working now. Just recently in the US, in the last 2 years, um, there were two major pharmaceutical drugs that were recalled as cancer causing. One was an anti-acid
Yep.
medication, and that many people were on, and chiropractors have constantly been saying, find the root cause, don't rely on these antacids. And the second one was one that we see a lot in our profession, and that's gabapentin. And that one they're linking to dementia. And I think that's really important for people to understand that these medications that stop nerve pain, they stop nerve pain because they're damaging the nerves. There's no way to stop nerve pain without damaging the nerves.
Point. And isn't it interesting that what would you say is like the time frame that it took for them to discover or admit this? Has it been years and years of use?
Well, it's been years. When I first started in Michigan, I had a patient who was 16 years old at the time, and she had had a bowel resection, and she was telling me that she was taking, I believe, 1,000 milligrams of gabapentin a day on a 16-year-old forming brain. Her brain obviously is not fully developed yet. And she was taking about 1,000 milligrams of gabapentin a day to control nerve pain. And I think those are the most haunting stories, when they're children under 18, they can't make decisions for themselves, and the parents are relying on these medical professionals to help them. And, chiropractors, we often tell patients that, please think twice before you go on a medication. We had the opioid crisis here in the United States. We've been saying for years that those are not the solution to neck and back pain. So I think we're being proven time and time again that the work that we're doing, first of all, is safe. Second of all, it's effective. And third of all, it's done with ethics and morals to keep patients away from drugs that we know are harmful to them.
Oh, well put. And I would add number 4 is the patient is the center and in control of their choices and decides for themselves, instead of this monster that's controlling us in almost every avenue now.
Absolutely.
Well, Morgan, I really enjoyed this chat.
Me too. Thank you for having me on.
It's like we bumped into each other in the street, and I hope we chat again, and we'll put some links in, or I'll have a chat to you about submitting some papers and having some assistance in writing those. I know some good people that'll help you out.
Oh, I would love that. And I appreciate that so much, Dr. Joe. Thank you so much for having me, and have a great rest of your day.
Well, I hope I see you in Atlanta soon.
Me too. Me too. We'll have to connect.
Yes. Thank you so much, Morgan. Enjoy your day.
Thank you. You too.